normally say, Broadway, you are number one. Sawa sawa. That's why you say, Broadway, you are number one. Today, I have a special guest who we have worked with her hand in hand since 2022. I was the first contact to receive you in the hospital. You people, you are lucky. We're having a breast cancer survivor, champion, by the name Nana. That picture over there is for Nana. She has gone through it. The best thing with Nana, she's much okay. She started new life. She accepted the life she is. She's a ambassador of it. Please kindly let's clap as we welcome our special guest.
Good afternoon, ho. Habari zenu. Thank you so much, Broadways. Mkate ni? Mkate ni? Thank you. Thank you so much, my friend and my personal doctor, Dr. Oduor. My name is Nana Kilemi. I'm a breast cancer survivor. Actually, I'm a champion. That's me. So I've been a survivor for the last 3 years. I was diagnosed with breast cancer in August 2022, actually just the other day. I was treated here in Kenya, and now I'm in total remission. Thank you. I'm here to tell you that cancer, whichever cancer, is not a death sentence. And especially to my fellow women, because cancer is really, really on us. Breast cancer and cervical cancer cases are on the rise. Every day we are losing 7 women to breast cancer and 9 women to cervical cancer, according to National Cancer Institute. So what happened? I know most of you are asking, Anna, what happened? And we can see you look okay. Yes, I'm okay because that was removed and then the doctors did reconstruction. So I felt a lump, you know, just a lump on my right breast for 2 years. I was very, very afraid of going to hospital. I was very afraid, and I know it happens to many women. But please, I'm here to encourage you today. The only thing will beat that monster, and so that you don't get to this space I am in, because it is not a good space. You guys see me looking this whole, but trust you me, my life has never been the same since 1st of August 2022. It is medical checkup. Tafadhali, if you are able to buy clothes to dress that body, then you are able to take that body to hospital for medical checkup once a year. So I felt a lump, and I was very scared. I never went to hospital. For 2 years, I was on painkillers because I thought it couldn't be breast cancer, but I couldn't imagine what will happen to me if I had cancer. But of course, 1st of August, things turned around. My breast had something called tethering, like a dimple. So when I saw that, I called my sister. I showed her what is happening, and immediately we went to hospital. It was the first contact person. And of course, it was like, you know, Nana, here we have to be very truthful. It is not going to be business as usual. Of course, this looks like sort of cancer, but before we confirm, let's do biopsy, ultrasound, and all those things were done. And of course, after 40 days of waiting, it came out positive. I was at stage 3C because it had spread to my lymph nodes. So first things first, they had to remove my breast and remove the lymph nodes. I was home for 5 weeks in drains and all these things, very painful journey. Then after that, I went for chemotherapy. That almost killed me. Dr. Oduor can say. For 9 months, I did chemotherapy. I lost my hair. Now that had come out. Now this is my new hair. See you clap for me. Can you imagine? I was completely bald. My story is all over the internet, on Instagram, LinkedIn, Facebook, Nana Kilemi. you can follow, because every day I do advocacy. So I went through treatment. For 9 months, I was treated here through chemotherapy, very painful, very bad, very expensive, very costly, emotionally draining, physically. But I thank God he pulled me out of pit hole. Then I went for radiotherapy for 2 months. That one sent me straight to ICU. I was in ICU for 12 days, actually, then I came back again, because I think God healed me because I have a mission. Then after 1 year, I quickly, I'm a very quick girl, and I wanted my life back. We went back for breast reconstruction, here still in Kenya. So my breast was reconstructed, so I have a normal breast again. And now I'm on 10-year treatment, which is called hormone therapy. Costly, very expensive, my dear Kenyans. But good thing is, every day, the medical field, the science is reviving. So the cancer of 2022 is not the cancer of 2025, because now they have new treatment called, I don't know, immunotherapy. Chemo is not as bad as it was. Radiotherapy is not as bad as it was. It is getting, but then we don't have to get there. I am begging of each and every one of you, those small things you are feeling in your body, as simple as hiccup, as simple as backache, as simple as, fatigue, today fatigue, tomorrow fatigue, stomach upset, especially for men. Dear men, my brothers, I'm begging of you, because only 2% of you are going for medical checkup. We cannot have so many men and only 2% of you are doing for. Why is your stomach having all this than you're feeling, and you don't have hormones? You don't have periods. Please go for medical checkup. Go for prostate cancer checkup, because now prostate is attacking men from the age of 35 years. My dear women, my sisters, our daughters, stop saying, hey, backache. Then you take painkiller like Nana. That is what I did for 2 years. That backache is going to be a serious problem. That change of nipple is going to be a serious problem. That change of your entire breast is going to be a serious problem. That fatigue, those heavy flows, those are all the things that I was feeling. And I ignored them for 2 years, because I was thinking, it can't be. But it got me to this space. And this is a very bad space. I'm telling you the truth. And out of 10 cancer patients in Kenya, unfortunately, 6 die. Oh yeah, because we have 44,000 new cases every year, and 32,000 die. And where I come from, Meru, we leaned. I don't know what we are doing, but now it is everywhere. It is, everyone in Kenya is either directly or indirectly. I'm begging of you, dear Kenyans. Let me tell you, cancer is not just any other disease. It is not diabetes. It is not high blood pressure. It is not, I am begging, and it has no boundaries. It doesn't matter who you are. If you hear any crazy changes in your body, tafadhali, go for medical checkup. That is the only way we'll be able to beat this monster, because in 2 years' time, cases of cancers, all kinds of cancers in Kenya, they have skyrocketed from 50% to 80%. Statistics show in the next 2 decades, 20 years, 70% of Kenyans will have cancer. But I'm here to tell you, we can stop this now. Change your habits. Go for medical checkup. Change your ways of eating. Go for exercise. My dear sisters, one of the risk factors of breast cancer is lack of vitamin D, whereas this sun is free. Please walk. I did not say gym. I say walk, run, bask, take water. The free things, the free medicine is here with us. Let us stop being ignorant. Let us being know-it-alls. Let us stop blaming each other for no good reason. Cancer is expensive, it is frustrating, and it is extremely draining because of the stigma. My dear sisters, that body is yours. Can we stop blaming men every day? Go for cervical screening. If you are HIV positive, every once a year, go for cervical screening. If you are not, once every 3 years, go for cervical screening. It is only around 1,500 in public hospitals. In most of public hospitals, it is free. In most of public hospitals, private hospitals, it's only 1,500. I am here today to tell you, yes, it is not a death sentence, but if you get it, it is going to completely mess your life, especially if you're not mentally strong. Together, we can change the narrative. Together, we can change the situation around. And together, we can do this. Thank you so much, and God bless you all.
Hi guys, you wanted to say something? Or you wanted to hold the mic? Okay, hold for 1 minute.
Welcome.
Hi everyone. We are just trying to think of something can be doing before Daktari gets here. But I didn't, did people ask some questions? They can ask now? Okay, good, here we go. He had some question. Okay.
Questions? Yes. Yeah, anyone with a question? Feel free, any question? Yes.
Yeah, that's fine.
Is when your body can get cancer. Don't have enough of vitamin D. So my question is it not having the vitamin D that can create cancer, or is it that when you have the cancer, it depletes your vitamin D?
Wow, you got it?
Yes. Okay. So, low vitamin D equals to very high risk of getting breast cancer in women. You need enough vitamin D in your body. What are the sources of vitamin D? Fish, eggs, cheese, what else? Tell me. What? Sunlight. Sunlight is free. The morning sun, not this sun. This sun has no vitamin D. The morning sun and the evening sun. Those are the sources. So you need vitamin D. If your body goes low on vitamin D, you have a very, very high risk for both men and women. So you need, and let's thrive to get the natural vitamin D from food and from the sunlight. I had someone say supplement. Yes, supplementing is good, but thrive to get the natural vitamin D. Did I answer?
Yes, thank you.
Okay. Anyone question?
Hello.
Hi.
My name is Virginia.
Yes.
You said when you feel like you're tired, every day you're tired. That means when we feel we are tired, we have cancer.
Yes. No. No. Let me tell you what I mean by tired. You know, there's that tiredness of not getting enough sleep, overworking. But there's that fatigue. You are sleeping, like what used to happen to me. I was then a very sleepy girl. But of course, now, everything was messed up by the treatment. So I would sleep at 7 in the evening and wake up at 7, and my body could be extremely tired. Then I could tell my house manager, tafadhali nipake a deep breath. She would be like, but you've been sleeping the entire night. Why are you still tired? There's that chronic fatigue. So you know your body. All of you, each and every one of you, kuna mtu ajui mwili yake, unajisikiza, you will know. Your body will always tell you there's something happening in your body. If you rest and you are still tired, rest and still tired, then there's a problem. And also another thing, being anemic. Why are you anemic? I was anemic for 4 years with no blood every day. Who is eating your your blood? It is the cancer cells. They love blood and they love sugar. They only survive on sugar, by the way, every day. That is what makes them thrive and kill you. I know that one people don't like, but it is a fact. So be careful. Another question?
It's very good to see men ask questions because you just made them aware that men do catch breast cancer. Let's hear from him.
Inaweza ambukizwa?
No, please, let's stop that stigma. Please. I am a single parent. I've dated men who are told, utambukizwa cancer na. No, cancer is not spread. The only cancer which we get through sexual intercourse is cervical cancer, which is spread by men because they are the carriers of HPV virus. That is why I was telling my sisters, you cannot keep on blaming the men. You can't. You have to go to hospital. Who is the woman? It is not your husband who is the woman, it is you. So it is your responsibility to go for pap smear. And our men, there is no trophy. DJ Mo, mimi sijasikia mtu amepewa trophy kwa sababu kuna babibi watano. Sijasikia, umesikia? Actually, you only get more poorer. True? You are more stressed because unaficha Nana, unaficha size 8, unaficha Nani, unaficha Winnie. It is so strenuous, men. Can you imagine Australia for the last 12 years? They have never had a case of cervical cancer. And there are people like us. Do you know what that means? Self-discipline. Sasa hiyo maneno amwezi leta maneno ya kasongo sijui nani. Hiyo ni nyinyi. And you can say we are really a very, very bad society. Statistics of HIV, they have skyrocketed in all ages. What are we doing to ourselves, Kenyans? So how many people have gotten trophy because you have 98 sexual partners? Show me one, DJ Moore. Can we start living like human beings and stop please living like animals? And you know, men, let me tell you, you will think that wife will get sick and leave her. But let me tell you, outside there, you are seeing us looking so good. Wewe kuja kwa nandi utajua ujui. Hiyo chumvi huku unataka kununua kwako, utanunua chumvi, nguo, kila kitu. Na nitakukalia hapo ngumu sana. Stay with your wives. I'm telling you, stay with your wives. One wife is enough. Don't think when God says 1 to 1 is a fool. Sawa? Did I answer? We are raw. Sindio? Tuambiane ukweli itusaidie. Sindio? Tuseme ukweli ituto? Sindio, DJ Mo?
So you've mentioned that cancer loves sugar. During your treatment, were you advised to take less sugar, or does high intake of sugar affect you to make you get cancer fast?
So there's a lot of change in diet. You have to change your diet once you get cancer. Let me read for you something which has been proved to work. And I would really like if you could even write this down. And for your information, during all my treatment, I only ate this brand. Especially the brown one is extremely good. And that is the only brand which doesn't give cancer patients acidity. So, well, thank you, Brookside. Brookside is our partner, Broadways. So, let me read for you something. So, before the doctor comes, I'm going to How to never get cancer. 8 scientifically proven tips by the doctors and the scientists. From the food that prevents cancer to the top ways to reduce your risk. Number 1, optimize vitamin D. And you keep vitamin D blood levels between 60 to 80 milliliters, ml. Why? This strengthens your immunity against cancer cells, and low vitamin D equals to high cancer risk. Vitamin D is gotten from fish, cheese, liver, from eggs, and all these things. You can Google others. Number 2 is intermittent fasting and prolonged fasting. Fasting ni kujinyima chakula. You can't eat, especially if you are 35 years and above. You can't eat breakfast, lunch, and dinner. Kwani you are a horse bwana. You need to give your body time to heal. Oh yes, because what happens when you fast, zile cells baya, they are eaten by the good cells, autophagy. So your body heals naturally. Fasting triggers autophagy, a process whereby your body recycles damaged cells into new ones. Can you imagine, even when I was doing my chemotherapy, I was still fasting, and it really helped me to heal. You can't eat like a horse, my dear. You can't. You have to give that body time to heal, because also food is killing us. So, if one of the best ways to prevent cancer, since cancer originates at the mitochondria, you know, all of you did mitochondria in school, the cells, in biology, all of us, don't please lie. Because I can see most of you are millennials and Gen Zs. We all did that in school, so you know what mitochondria are. Don't tell me to tell you, please Google. Periodic 3 to 5 day fast, the best way to trigger autophagy. 24 hours, 48, 32, that is it. Then keto diet. You go low on carbs or keto. Low carb diets, they starve cells. They only thrive on sugar. It results in insulin sensitivity and stabilizes blood sugar, allowing damaged mitochondria to heal. It fuels your body with therapeutic ketones. You've had people being told they have ketone stones, and they are very, very dangerous. Then cold therapy, kuoga na maji baridi. It slows cold water immersion and stress to your body that forces it to make a lot of more mitochondria. It also builds stronger, more resilient cells. Number 5, you cook smart. And garlic, thyme, onions, rosemary to your food to counter carcinogenic effect. Then consume anti-cancer foods, vegetables, broccoli, green tea, pomegranate, and all those things. Avoid excessive iron, because cancer cells thrive in iron. Skip the supplements and cook with iron skillet. Then get moving, walk, run. You know, lack of oxygen can promote tumor growth. Exercise floods your body with oxygen. Walking through a forest can boost your immune system and help kill cancer, thanks to a vapor emitted by pine trees. So if you have not been touched, nimewambia, sindio? Yes.
Tumpigieni makofi. You know that place for cold water, cold water. Have you heard that? So Dr.
Yes.
is requesting we come, we fill up the front space. How do we do it? The last 2 rows, can they come in front?
Yeah, the ones seated at the back.
Yeah, at the back. Wanasemanga the one at the back, one day they be in the front. So guys, come in front, please, before Dr. comes here. And you can be playing a game. If you're happy and you know, clap your hands. No. Did we had eaten? They had eaten. Why are they clapping like that?
They should be clapping a bit louder, and now the doctor is here.
We try, eh?
Yeah.
Oh, he's here. If you're happy and you know, clap your hands. If you're happy and you know, clap your hands. If you're happy and you know, and you really want to show. If you're happy and you know, clap your hands. If you're happy and you know, slap your neighbor. Wait. Wait. What's happening, my brother? Yeah? She should be your friend. If you're happy, no, slap your neighbor. If you're happy and remove her wig. I know, yeah? We love you, ladies. So, Dr. is here. So, are we ready for the talk? Are we ready for the talk? I knew last week, genuinely, I knew last week that men can also get breast cancer. And he's the one who told me, Dr. Marek, trust you me, I knew last week. I even did a post to tell guys they should go and get tested. Simunipigie makofi. And that's one of the main reasons that's why I'm here. So without wasting much time, let's give it up for Dr. Marek. The other names I can't pronounce, by the way. It's really hard. Okay.
Hello everybody. I'm very sorry for being late. I think I probably spent too much time close to the Kenyan government people. I don't know. They're always like that.
Yeah, Dr. Jackie would know about that. I'll do quick introductions and then the floor is yours. So we're very privileged to have Dr. Marek here. Dr. Marek is a consultant general, an oncoplastic breast, skin, and endocrine surgeon. He has worked as a consultant general and breast surgeon in the United Kingdom, Poland, and Kenya for over 15 years. He graduated from the Medical University of Gdansk in Poland in 1995, and thereafter trained in general surgery, receiving the Certificate of Completion of Training in 2008. Subsequently, he undertook subspecialty training in breast cancer, oncoplastic reconstructive surgery, and surgical oncology. In 2012, he obtained his European Board of Surgery qualification in breast surgery. He's currently with MP Shah Hospital, and we've known him for a very, very long time. We've worked with him in the past under Broadway as well, and he's a family doctor to my sister as well. So welcome, Dr. We have in the room staff of Broadway Big and Big X. We also have staff of other organizations based in Thika, and we have general public from Thika in terms of our community, as well as level 5. There's a Dr. there as well. So over to you, and we want to make this as interactive as possible. So thank you.
Thank you so much for having me here. Thank you very much, and thank you for being so patient, and sorry for keeping you waiting. My full name is very long, it's Polish. Okay, I'm not South Indian. The South Indian names are even longer. But my full name is Mariusz Marek Ostrowski. My father-in-law, I'm married to an Indian girl, so I'm Polish, Kenyan, and Gujarati at the same time. My father-in-law used to tease my wife, calling her Mrs. Ostrowiski. Whiskey, probably it's easy to remember. But everybody here in Kenya calls me Dr. Marek, Malek, depending where you come from, Manek. Marusasu calls me Manek. So I understand that it's about me. Thank you so much for having me in Thika. I'm very excited. We've been talking about it already for some time, actually. And thank you. I'm here because there is a problem we have in Kenya, and it's called breast cancer. There are two biggest killers of ladies here in East Africa. One of them is breast, and the other one is cervical cancer. And I would like to talk for a few minutes about it. Please feel free to stop me, feel free to ask questions if you'd like to. We are here to spread awareness. We are here to make sure that you go home and do your homework, because I have a bit of homework for you, every one of you, please. So, we know that breast cancer is a problem. Breast cancer is the biggest, or let's say the most common cancer globally on Earth, in Kenya, and so on. We know, we have data that breast and cervical cancers are the two biggest killers of women here in East Africa. It's annoying, it's upsetting, it's frustrating, whatever you want to say, call it, because it doesn't happen in Europe and in America. Still, the breast and cervical cancers are very common, but they do not kill. So what's different? Why do you think we have an issue in Kenya and it's not such a huge issue in Europe? Why? Early awareness. Yes, we are here to talk about it because very often, especially here in Kenya, it's like, I'm not going to tell anybody I had a problem. I'm not going to tell my child. I'm not going to tell anybody. And then what happens, I have patients coming to see me. I ask, any cancer in the family? No. Did you speak to anybody? Yes. And nobody talks about it. Yes, just yesterday I was talking to a lady who is a cancer survivor. She had cancer, she's fine for many years. And she said, look, I spoke to everybody in the family and then only after my treatment they said, ah, really, so you had it as well. You know what, I had it, she had it, and he had it. Yes, but before she was diagnosed and treated, it was like taboo, don't tell anybody. Do you know that in Kenya people still believe that you can catch breast cancer when you sit next to someone? I'm not being funny. They think it spreads the same way flu spreads. Yes? So we have many taboos, we have many myths around, and we are here, and I'm so happy, thank you so much for all of you being here, because we are here to change it. Yes? Can I have next slide, please? I'll be very quick. I have a few slides, but it's not school, so it's not about reading the slides. Yes? Yes, it's a common problem. It's the most common problem. The problem is becoming bigger, especially in places called low and middle income countries. Kenya is which one? Low or middle income country? Middle income country, yes. That's why Trump doesn't want to give us too much money. Okay, but it is a problem. Yes, it does happen. Next, please. Just one number, and this is the number from 2022. This is the number from an organization called Globocan, and Globocan estimated, because it's not a real number, that in Kenya in 2022 there were 7,243 people, because it may happen to men, people diagnosed with breast cancer. Is it true? No, it's not. Unfortunately, it's not. This is just an estimation. And unfortunately, the numbers are probably 2, maybe 3 times bigger. Yes? Still in Kenya, we have many people suffering from breast cancer, and then the doctor says malaria. What's the biggest killer in Kenya? Mosquito, yes? But mosquito is the biggest killer. The animal which kills the biggest number of people in Africa, in Kenya, is a mosquito. And it's true, malaria is a problem, but there are other problems as well. Now, are we different? Why, my question was, why cancer, breast cancer, cervical cancer in Kenya kill people here and they don't kill people in Europe? We don't know exactly, but one of the reasons is awareness, screening. We'll talk about it later. Screening means we can catch cancer before it becomes cancer. And we'll talk about it later. Now, there is a slight difference which we don't understand. Here in East Africa, here in Kenya, breast cancer happens a bit earlier. We diagnose breast cancer in ladies 10 to 15 years younger than those in Europe. Okay, so there is something going on, but nobody understands why. Is there some special genetic mutation? We'll talk about the genetic mutation in a minute. Is there some kind of pollution? Yes, is there something what causes it? We don't know, but right now there is a group of people trying to solve that problem, but it will probably take 10 to 15 years, maybe 20 to understand. Next, please. Now, the difference between here and Europe is that in Europe, or let's say in well-developed countries, we can cure most of breast cancer patients, 90-some%. Okay, here I put 90, yes, but this is including the early cancers and those slightly more advanced cancers, while in Kenya the number is 40. It's scary, yes. Why? Because 70 to 80%, 7 to 8 out of 10 people coming with breast cancer to see a doctor come very late, when cancer has spread already. It's so-called stage 4. And again, we are here, and it's exciting because there are quite a few of us. We are here to change it. Next, please. We have 2 issues. Issue number one is the awareness, the public awareness is what we people think about it. Issue number two is myself and my medical colleagues. Daktari, I think, yes, it's good you are here, we can talk about it. Number one, we don't want to talk about breast cancer, the public. Number two, we medics are not really too clever and not too aware as well. There was a study done at Kenyatta National Hospital, and the researchers have proven that in Kenya, a woman with a breast lump needs to see on average 6 medics before she's diagnosed with breast cancer. 6 medics. Yes, I don't think we are too clever, we medics. So you can imagine, I have a lady who comes to see me, I say, no, you're too young, go home. Then 6 months later, she has the lump and it keeps growing, she goes to see another doctor, no, go home. It takes 6 medics. Yeah? So there is lots of learning for all of us. Now, very often when I ask the question, do we have enough instruments? Do we have tools to diagnose the cancer, to treat the cancer? Do we need to travel to, let's say, India? What do you think? We have everything in Kenya, everything we need to diagnose the cancer, to catch it early, to treat it, and so on and so on. Yes, India is cheaper, doesn't mean it's better. Yes, it's cheaper a bit, but we have brand new mammograms. Government in Kenya bought, a few years ago, bought 91 brand new digital mammograms. Mammograms are those machines which squash the breast to take an X-ray, the screening machines. We have 47 mammograms. In every single county hospital there is a brand new mammogram. The question is, are we using those mammograms? Are we using those machines? We don't. Okay, we have no labs, we have some problems with labs. It's only, unfortunately, the cancer centers, the pathology labs are centralized in Nairobi, so it makes things a bit more difficult, but slowly things are changing for better. This is a very important message to take home, please. Breast cancer usually happens to women. Why? Why does it happen to women? Because women have boobs. One has to have breasts to be able to be diagnosed with breast cancer. Yes? So it's usually women, and it's usually women because most of breast cancers feed off female hormones. Yes? Not every single one, but most of breast cancers feed off hormones. But gentlemen and ladies, please remember, breast cancer may happen to men. For every 100, for every, let's say, 99 women with breast cancer, there is 1 man. And we men, so we men, we are silly enough to think, no, it doesn't happen to me. A couple of years ago, I had a gentleman who had a lump on his chest, okay? He had no breast, very thin man, 45, let's say. He had a lump on his chest for 7 years. The lump was 7 centimeters, huge. Like, he says, no, this is not painful. I didn't think men can get it. Nothing to worry about. No, men can get it. Yes? Next, please. Now, I can see you are so nice and so kind and nobody's playing with a phone. It's actually very distressing. I need you to take your phones, open your phones and Google Know Your Lemons. Please, I mean it. Yes, this is the time you can officially play with your phone. Because this is a message which I want you to take home and I want you to spread the, whatever we call it, the Alleluia. Yes? Know Your Lemons. Know Your Lemons, it's an international NGO. They are online mostly, but not only, to help people, mostly ladies, to understand their breasts. They have they don't pay me, please, so it's not, I'm getting nothing for it, but they talk about the breast cancer symptoms, and the easiest way you can talk about breast cancer symptom to your imam, to your priest, to your anybody, mother, grandmother, because you are talking about lemons. And when you look at it, yes, can you see the nipples? Yes, so they look a bit like breasts. So these are the 12 most common symptoms of breast cancer. Usually, breast cancer, because it happens to ladies, most of those 12 symptoms will happen to ladies, but you know already that one of them may happen to men as well. Yes? Homework. You have your phones in front of you. I don't know if you can see it. Let's go back. I don't know if you can see it. I want to concentrate on this a bit longer because this is the learning, the message to take home. Yes, this is... Now, is pain a breast cancer symptom? Can you see pain? There are 12 symptoms. Is there pain? Pain isn't. Yes? Why? They're cheating a bit. Now, we humans are really naughty. We are so used to text messages, WhatsApp messages, emails. We are waiting for God or whoever there is to send us an email with pain or with, I don't know, some lightning saying, oh, there is cancer, go and have it checked. Cancers do not come with pain. Yes? That's why you hear someone, oh, everything was fine, and then suddenly the person was diagnosed with stage 4 cancer. Doesn't matter whether it's breast, prostate, pancreatic, colon, there is no pain. Breast cancer is very painful when it's metastatic, when it spreads to brain. Very painful, very difficult to deal with. Yes? The pain is so severe that it's very difficult to deal with it. But at the very initial stage, which we are talking about, the screening, there is nothing. Yes? So, ladies and gentlemen, I'm talking to gentlemen as well because many ladies who come to see me in the clinic, they say, my husband or my partner found something and he told me to go and investigate. It's very important. You are responsible for many breasts, boys. Apparently, to be a good Kenyan man, you have to have at least 4 wives. Is it true? Not enough? More than 4? No, but I mean it. Yes, because we have mothers, we have sisters, we have wives, and so on and so on. So, how do we examine the breast? Has any one of you ladies do a self-examination from time to time? What do we do? How do we do it? Do we do it every day? No. You'll have bruises if you keep touching your breasts every day. Yes? Do we do it once a month, once every 2 months, 3 months? Yes, please. How do we do it? Number one, what is very important is to know your breasts. So, gentlemen, when you look at the breasts, you can see the skin and the nipple, usually. Usually it's 2, but there could be 4, there could be 6, there could be 1. When a woman has only 1 nipple, when she had surgery for breast cancer, usually, and the breast is missing, yes? But usually we see 2 nipples, sometimes 4. Please don't get upset if someone has more than 2 nipples. It's very common. It's actually very common, not even a problem. It just happens. Yes, so we see the nipples, and the nipples are just there. Okay, sometimes there. Yes, but usually they're just there, and the nipples are trying to tell us, is there anything to worry about? What can happen to the nipple? Come on, let's talk to young girls. When the nipple is trying to tell us, please have it investigated because there may be something growing inside. Where are your phones? Just cheat a bit. Check your phones. This is the time you are allowed to cheat. Okay, not cheat. I want you to remember. Okay? What can nipple do? If there is something growing behind the nipple inside the breast, this something may pull the nipple in. Yes? In medical slang, we call it inverted nipple. Yes, the nipple can be pulled in. Very often, the nipples are pulled in, and there are many young ladies who are growing up with inverted nipples. Yes, so please don't panic. It happens. It's a very common problem. But at the age of 40, the nipples are fine, and then suddenly one of them goes in. This is dodgy. This has to be investigated. Yes? What else? Can the nipple cry? Has anybody ever had any nipple discharge? No, nobody breastfed a baby? I didn't, I'm sorry. Yes, but I hope at least some of you did. Yes, the nipples are there to breastfeed the baby. So discharge, okay, any leak from the nipple which is milky, It's normal, it's usual, can be annoying if you don't breastfeed, but it's fine. But sometimes the nipple may be crying. I'm saying the nipple because it's not both, it's usually one. And when I say crying, it's tears, clear fluid. The nipple is trying to tell you, please go and have it checked. Sometimes the nipple may be so annoyed that it may bleed. Yes, then it's even more serious. We have to go and have it checked. Yes. Now, there is one more thing. The nipple may look crusty. Crust usually means eczema, itchy. It happens. I'm sure that there are many ladies here who had itchy nipples. Once a month or from time to time, you buy a new bra, you put your bra on, or you use a new soap, and then the nipple is like, okay? But if it's not itchy, there is a crust, and the crust doesn't go away after, let's say, 6 weeks, then it may be a symptom of breast cancer. There is a special type of cancer which we call Paget's disease, and it's exactly crusted nipple, and it doesn't go away, and it keeps growing, growing, growing. I have a picture somewhere, a lady with a crusted breast. So you can imagine it took a few years to grow. What else can be a symptom of breast cancer? Lump. Most common symptom when you have it there is a lump. Lump, bump, whatever, but please don't panic. If you notice a lump, only 1 in 10 lumps are malignant, cancerous. Not every lump has to be cancerous. But if there is a lump, please have it investigated. It's better safe than sorry. And then, when you look at it, there are at least 8 probably different symptoms related to the skin, but the easiest way to talk about any changes in the skin is if you find something in the skin and it doesn't go away after 4 to 6 weeks, please have it checked. Two patients of mine, friends of mine, yes. So one lady came, this was a long time ago, this was 2013, so 12 years ago, she's still fine, she's still alive. She came and she said, I came back from holidays, I have a mosquito bite. It was a tiny little bite. But she said, you know what, it's already 5 weeks, maybe 6. It's not itchy and it's not going away. Usually mosquito bites go away. I was like thinking, yes, she's right. Mosquito bite, holidays, she went on a cruise. I don't know, she came to Kenya, she went back to the UK. I was in England at that time. And then next to me, there was a very clever lady, a breast care nurse. She says, Marek, take a sample, take a biopsy. I did, and it was a very vicious cancer. Yes? What looked like a mosquito bite was a very vicious inflammatory carcinoma. It's very rare in Europe, in Wazungu breasts, but it's quite common in Kenya. Yes, I've seen many more here than I saw in Europe. Then there is another lady, again it's in the UK, a lady came with a spot. You know, spot, we have a spot sometimes here, sometimes there. She had a spot on her breast. She comes and he said, this is cancer. I said, no, it doesn't look like cancer. Come on, I have a spot here. She says, no, it's a cancer. And then she said, I want you to take a sample. I said, I'm a plumber, you pay, I do. Of course, in England, nobody pays, yes, because it's free, but I did and she won. It was cancer. Yes, this lady was right. This is how I learned with my patients, how I learned how to be, what would you call it? Just to be, you trust the patient. Yes, because they know much more. They know their breasts much more than all of, I don't know, doctors put together. So, any change in the breast, please have it checked. Is there anything else? Yes. Next slide, and now we'll be talking because yes.
The lymph nodes, because you find out most of the women don't have breast cancer, but the lymph nodes are affected.
Yes. Thank you so much. It's very important because breast is sitting on the chest and we have 40, every one of us has about 40 lymph nodes in each armpit. Lymph nodes is whenever you go to see the doctor says, oh, let me check your glands. Are your glands fighting any disease, any problems? The lymph nodes are there to protect our bodies from viruses, bacteria, cancer, and so on. Now, what is very important, it is when you look at your breast, let me just finish something else and then we'll get there. So you look into the mirror. First what you do, because I think I missed it, we do up and down. Usually the left and right breast, they move at the same speed. But if one breast is a bit bigger or another one is a bit smaller, or one of them is a bit slower moving up, then we have to investigate, because maybe there is something there pulling the breast and it cannot go up and down happily like the other one. Yes? Now, sometimes what happens, and when you examine your breasts, it's very important, of course, flat fingers, you touch your nipple gently just to check it, touch with the flat finger, 2 or 3 fingers. Sometimes you can do it round, sometimes, let's say, follow the clock, so it's 12 o'clock, 1 o'clock, gently, gently like this. But it's very important to put your finger into the armpit. And that's a very good question, because sometimes the breast cancer may show itself being a lump in the armpit. Yes? From time to time, what we see is, we see a big lump in the armpit and nothing in the breast. So we are like, it's breast cancer in the armpit, but where did it come from? Very often there is no answer. Very often maybe there was cancer which body dealt with. The body managed to kill the cancer, the original cancer in the breast, but whatever spread to the lymph nodes just stayed there. Yes, the lymph nodes are very important, and we'll talk a bit more about treatment. We'll talk about what we do with the lymph nodes. Now, the question is, can we do anything to stop the cancer? What do you think? Can we pray? Will it help? Yes, if someone believes in it, it will help. Yes, because if someone prays about it, then maybe we'll remember about doing the self-examination and doing the screening and so on. Basically, when we talk about any cancer, there are things which we can change, for example, the lifestyle, but there are things which we cannot change. You know that breast cancer happens usually to women. Can you change it? Can you become a man suddenly? Not really. If there is family history, if there is mother breast cancer, grandmother breast cancer, there is genetic mutation, can we change the mother? Not really. But can we change our lifestyle? Can we live a bit healthier? Yes? Yes, we can. And we know that we can reduce the risk of different cancers. So now let's do the next one. I'm sorry, this is very tiny, whatever, but I will talk about it. So, we humans, recently, we are very, very naughty, very boring and lazy. We have big cars, we drive to the shop, we drive, we drive everywhere. You see it in Nairobi. From first parklands to second parklands, it's 50 meters, but we have to drive. Our grandparents didn't have that problem because they didn't have cars, so they were walking. That's why we see many more cancers now, possibly because we are lazy. Lazy meaning we become a bit bigger, fatter. Fatty tissue stores and releases estrogen. And we talked about it already. Estrogen is the cause of breast cancer. So being obese, let's call it properly, being obese, does it increase the risk of breast cancer? Yes, it does. Can we change it? It's not easy. I've been trying for I don't know how many years, but we can. Yes, we can try. Yes, we should try. So this is number one. How do we maintain our weight? How can we maintain that fatty layer on our wherever it is? Yes, we eat well. We are what we eat. So definitely we have to make sure that we look after what we eat. Just a couple of, when was it? A couple of days ago, we were talking about the level of sugar in bread or in something else. Is it true that sugar causes cancer? Not directly, but sugar makes us fat. And we know already that being fat, obese, increases the risk of many cancers, including breast cancer. So yes, indirectly, the sugar is responsible. So who's responsible? Stop the video. The British, isn't it? Because they started the sugar, they started the slaves, and they started the whatever. Shh. Okay. We know that raw, let's say red meat, too much red meat, or let's say red meat which is especially barbecue, so nyama choma, well done nyama choma, may increase the risk of different cancers. So what is easiest? Become a vegetarian. Yes. Okay, there was a study many years ago, and it was a little study on a very small group of people, and nobody takes it seriously, but this was a study on so-called newborn vegans. At one point, there are some people who just stop everything, and everything is soya. Soya milk, soya meat, soya everything. So breakfast, lunch, dinner, whatever there is, it's always soya. And in that small group of people, there was more breast cancer than in a general population. Is it because they eat soya only? Difficult to say. Yes, maybe. Yes, but is it because soya is sprayed with something to grow faster? Maybe, we don't know. It's very difficult to say. Did you know that 40% of pesticides in Kenya are banned in Europe and in America? Is it causing the breast cancer? Is it why we have breast cancer 10, or let's say we diagnosed cancer here in ladies 10 to 15 years earlier? Maybe, we don't know. Being active, yes, we know it, and I said it already. Because we use our big cars, so I remember I left Kenya in 2005. I had to go back to Europe, finish my training, and that in those days we had cars, but the cars were much smaller, much older. Then I come back a few years later and it's like BMW 5, X5, whatever, Lexus 300 something. It's amazing, yes? But those cars make us lazy and make us fat, and we have to do a bit of exercise. Alcohol. Yes, Jesus turned water into wine, so I will never say that alcohol is bad, but a bit of of course, alcohol can cause problems, including cancer, yes? So tiny bit from time to time is fine, but sometimes too much is not good. Smoking, of course, and these are things which we can change. Yes, smoking. Did you know that smoking, apart from causing lung cancer, because we all know that this is what it causes, did you know that smoking can cause kidney cancer? Where is kidney, where is smoking? It's just like silly, isn't it? But it does. So it means smoking can actually cause many different problems, including the higher risk of being diagnosed with breast cancer. We talked about the family history. We cannot change the family, but we can learn more about the family history, and if there is some kind of pattern, grandmother breast cancer, auntie breast cancer, sister breast cancer, then we can do genetic investigation. We can do a genetic test. Do you know Angelina Jolie? Who's Angelina Jolie? Did you know that she has no boobs? It's impossible. She's such a sexy woman, isn't she? She's the star. She has everything. You know, I believe men dream about her. She has no boobs. She's the one, a few years ago, I think it was 2011 or 12, she told the world, she said, look, my grandmother died because of breast cancer. My mother's sister had breast cancer, so she did the test. And she is a BRCA gene mutation carrier. With the BRCA gene mutation, the risk of being diagnosed with breast cancer is up to 90%. So the question is not, will I ever get cancer? The question is when. What she did, and she openly told the world, she had the risk-reducing surgery, which means she has breasts. I didn't do the surgery, unfortunately, so I don't know what's there. But most probably, her breast tissue was replaced with an implant. Yes, most probably silicone implant. So she looks sexy, but her risk of being diagnosed with breast cancer from 90% went all the way down to 4%. In general population, just here where we are, yes, without family history, the risk is 9–10%. So she's much lower than every one of us with the gene mutation. Why am I talking about it? Because once we know the family history, once we know that there is something, we can deal with it. Yes? Doesn't have to be, and please don't panic, I'm not talking about surgery just to slash the breast. Now we have different types of surgery, and we can remove the breast, we can keep the skin envelope and rebuild the breast so it looks sometimes better than before. Yes, because we can lift it, we can make it bigger, smaller, whatever you want. Yes? So we can reduce the risk of breast cancer, indeed, once we know. Yes, so knowledge is very important. Screening. Finally, we are coming to screening. October is the Breast Cancer Awareness Month. October is the time when we talk about cancer. Is it because the people are diagnosed with breast cancer only in October? Stupid me, isn't it? Of course not. But, you know, at least, did you notice I'm wearing pink? Pink shirt. Yes, it's the pink October. It's the time when we talk about breast cancer. And yes, it's true, we diagnose more breast cancer in October only because we talk more about the diagnostics, about the cancer, about screening and so on. There are two biggest killers of women in East Africa, breast and cervical cancer. You know already that those cancers don't kill women in Europe because of screening. What's the screening tool for breast cancer? Mammogram. We talked about it already. Yes, it's an X-ray. It's an X-ray. You put your breast in between two plastic plates. Some ladies say that they were told that mammogram is like putting your breast between two doors and slamming the door. Trust me, it's not true. Please, don't believe in it. Please. Some people say if you have a mammogram, you'll have cancer. Of course, it's not true. Yes? The mammogram, if we do screening properly, screening mammograms, which are done properly once a year, once every 2 years, depending on the family history and so on, can catch abnormality 3 years before it becomes lump, 3 to 4 years before it becomes cancer. Yes? So it's so important to do the screening. If we catch it very early, just a few spots of microcalcification, which is not even cancer, which is very beginning of something what may become cancer, a bit of surgery to remove it, that's the end of the story very often. Yes? Very often people say, oh, I don't want to go for mammogram because what if they find something? If we find it early, then number one, we saved life, and number two, we saved lots of money. Treatment of breast cancer could be millions of shillings, yes, depending on the type of cancer and so on. And what's the screening tool for cervical cancer? Pap smear. Yes, the pap smear is the most common. We do it for last many years. Papa Nicolau, many years ago. Now we have more modern tools. We have, because we know already that cervical cancer is caused by human papilloma virus. So there are special tests which can catch the papilloma virus DNA, and then we can treat the virus so we can reduce the risk of infection, because cervical cancer is caused by an infection on the cervix caused by the virus. So if we catch a bit of infection, we treat the infection, treat the virus, that's the end of the story. Okay, screening. Officially in Kenya, we talked about it already, I think I mentioned, official screening in Kenya is copy-paste from America, which doesn't work in Kenya. It's 40 years, we begin from 40 years of age, up once a year up to 55, and then we do once every 2 years from the age of 56. Is it correct? Are we doing a good job? Of course not. I think I just told you that 40% of ladies with breast cancer in Kenya are in their 30s and very early 40s. 1 in 4 breast cancers in Kenya are ladies younger than 40. So our screening misses 25% of cancers. Yes? Let's hope we'll work on it. There are some people who want to change it, and we hope we'll change it and we'll improve it. This is the message which I said 3 years. Next, please. Now, this is a difficult slide, but I wanted to put it here for you to understand that there are different types of breast cancer. Usually we think, okay, breast cancer, it's probably some kind of red something. I had a student who asked me, nursing student, he asked me, so how does it crawl? How does it spread? Okay, this is what we think about cancer. Breast cancer, there are at least 10 different types. And most of breast cancers start in the duct. Yes, this is a milk duct cut across. So that's why we very often talk about ductal carcinoma. But there are some other cancers, lobular carcinomas and papillary carcinomas and some other, but the most common is the ductal carcinoma. Now, very often I'm asked, my colleague was offered chemo and you told me I don't need chemo. Why? Because different cancers may need slightly different treatment. Yes, and if we catch it early, very often we don't need that chemotherapy. Yes, that's why screening is so important. Next, please. Basically, we talked already about all the screening tools. We know that we can catch cancer in Kenya. Every single county hospital has means to do it. Most of private hospitals can do it. Now, treatment. Do we have treatment, all the available treatment options? Are they available in Kenya? Yes. Yes, we have surgeons. We have more and more surgeons doing a very good job. We have often young Kenyans who go to study, to learn somewhere else, mostly in the UK. There is a good exchange program with the British surgeons. They come, and I'm sure they're doing much better job than their older colleagues. So I'm a surgeon. You have to trust me that surgery is very important in breast surgery. It is. Yes, of course. This is how I make money, but it's true. But I cannot cure breast cancer on my own. Because to cure many breast cancers, not all of them, but to cure many breast cancers, I need a teamwork. I need my oncology team, I need my radiotherapy team, I need my, of course, radiology team and histopathology team and so on. It's a teamwork. Because some cancers, so let's say many cancers will require surgery. For many years, we used to believe, we meaning the doctors, the surgeons, the people, that mastectomy, the surgery to remove the breast, is the best way to deal with it. It's not true anymore. There are still a few different types of cancers when I have to remove the breast, because it's not safe to keep the breast. But in most cases, 8 out of 10, I can save the breast, and it's safe for the patient. So we keep the lady happy because she has both breasts, and we keep the cancer under control, we cure the cancer. So surgery, but surgery on its own, it's not enough. I need radiotherapy, radiation oncology, yes? So the radiotherapy, is it available in Kenya? Yes, it is. Unfortunately, most of the radiotherapy centers are in Nairobi. Everybody wants to make money in Nairobi. Fortunately, we have some cancer centers outside of Nairobi. It's Eldoret. There is one very good one working quite well, about 3 years old, in Nakuru. There is one in Mombasa. Unfortunately, it's a government organization, so it's on and off, more off than on. There is one in Garissa. They never started because the government bought new equipment but forgot to buy software. And so on, but it's there, it's getting better. We talked about chemo. Some cancers may need chemo, not all of them. Those cancers which are feeding off estrogen, they can be treated with anti-hormonal tablets, sometimes injections. Yes? So sometimes we can offer the anti-hormonal injections, and now also in Kenya we have so-called targeted therapy. So this is Herceptin, this is a special medication for some cancers, and immunotherapy and so on. It's very expensive still, but it's available. Just, of course, I'm a surgeon, so I need to show off a bit. This is how we remove the breast. This is a very old picture. You can notice that the surgeon removes the nipple, the skin, the fatty tissue, the breast tissue. This one even removes the muscle. This is something we call radical mastectomy. I've never done one, not because I don't know how to do it, it's because I'm too young. This was done many years ago. But I saw one patient in England who had surgery in Egypt, and she had radical mastectomy. Basically, the surgeons removed the muscle, the many things. Now, I mentioned at the very beginning that now the treatment is about keeping our patients happy for many, many years. Because breast cancer is not a death sentence anymore. We want to make sure, I want to make sure that when my patient looks into the mirror doing her hair, she's not crying when she sees her scar. Yes? So we hide the scars. This is just one of the techniques. This is one of the techniques which we use for breast reduction, because breast surgeon is not only about cancer, it's about making them bigger, smaller, I don't know, juicier, whatever you want. Yes? But we use the same techniques to deal with cancer. Next slide, and then of course, because there are cancers could be in different quadrants of the breast, there are different techniques. Let's hope we will never need to talk about it in person. Next, now, lymph nodes. You see, you asked me that question about lymph nodes. Breast cancer spreads to lymph nodes. If it spreads, usually it spreads to lymph nodes first. For many, many years, we surgeons, we used to do mastectomy to remove the breast and axillary node dissection. In our medical slang, it's called modified radical mastectomy, or radical mastectomy, the one which we just saw. When I was training, it was a few years ago, I will not tell you how many, my professor wasn't happy when I was removing fewer than 20 lymph nodes. Oh, you didn't do a good job, what's this, what surgery is that? Actually, my professor was wrong. Now we know that old belief that more is better, it's not true at all. Yes. Now what we do, and we have it in Kenya as well, we have the technology in Kenya, we can remove a few lymph nodes, 2, 3, 4, rarely more than 5, and it's called sentinel node biopsy. I'm based at MP Shah Hospital. I'm a private doctor, so I'm at the Doctors Plaza MP Shah. But a few years ago, I managed to force MP Shah to get me a little toy, I'll show you in a second, a machine, little machine, which allows me to save the lymph nodes. There is another hospital, it's Aga Khan in Nairobi. They can do it as well, but they have a slightly different, more expensive technology, a bit older, but still very good. Yes, so this is sentinel node. This is the little machine. It's very exciting, and it's actually not expensive at all. It's cheaper than an electric car. Next, please. Now, the same machine, this Sentimag machine, allows me to save breasts. This is, I'm very sorry, the way I did it, unfortunately, it looks like these are two different breasts, because one of them is slightly flatter, the other one is a bit bigger. Yes, but it's the same lady, the same breast. What is the same, can you see that white comma, this white spot? On the left, you see the white spot sitting in a lump. Can you see it? That's the cancer. This is what cancer may look like on a mammogram. Yes, and this lady, because of the type of cancer, she had chemotherapy first. Yes, because in her case, this cancer required chemotherapy. So, and she really wanted to save the breast. So look what happened to this cancer after 8 sessions of chemotherapy. It disappeared. Chemotherapy killed the cancer. Yes, but because she had that little clip, I was able to find it and remove the area, because there is still risk that although we cannot see the cancer, there may be dormant cancer, just something waiting to wake up and start growing again. Yes, so the still surgery is very important. Yes, so this is the Sentimag. Next, please. Okay, this is just a video, so basically in the theater, next please, I have a bit of tissue and then I can touch the probe to the tissue and it makes beep noise and just tells me, yes, lucky you, you removed whatever you were meant to remove. Okay, next please. Next please, this is just a video, but it's, and then this is the sentinel node, so this is using that different dye which allows me to remove not many lymph nodes, just a few. Next please. Thank you so much. I think I will stop here. And I think now we open the floor. Questions, comments, please.
If anybody has a question, I can pass on this mic and then you can get.
Thank you very much for this question. Number one, which I didn't stress probably enough, many of my patients, friends, family, they say, oh, it's not in my family, it will not happen to me. Is it true? It's not. The breast cancer happens, or let's say, out of 10 cancers, only 1 happens because of the family history. 9 out of 10 breast cancers happen and we don't know why. It's just like 1, 2, 3, 4, 5 bends. That's the one, this is the woman who will develop breast cancer. So only, to be very precise, it's only 11% of breast cancers run in the family. Yes? So it's not very common at all, and that thinking that, oh, it's not in the family, it's not going to happen to me, it's not true, it's wrong. Now, having one cancer in the family probably means that it's just one of those incidental cancers. Yes, it doesn't increase the risk. But if there is a pattern, grandmother breast cancer, auntie breast cancer, I don't know, uncle prostate cancer, some pancreatic cancer or colon cancer, and everything is in one family tree, then there may be a genetic mutation. Yes? So it's a different story. We can test it in Kenya. It's available in Kenya, and luckily it's getting cheaper and cheaper. Yes? So easiest is to talk to someone who deals with it. Yes? Talk about the family risk and maybe consider the BRCA gene mutation test, the way Angelina Jolie did. Yes? Now, if it's only one grandma and that grandma had breast cancer at the age of 78, it was most probably nothing to do with the family, with the gene mutation and anything else. Yes? Now, I would usually recommend, if there is any cancer in the family, because what cancers can be together, let's say, be related to one genetic mutation? Breast and ovary, breast and prostate. Yes, so there could be some prostate cancers. Breast cancer in men, yes, increases the risk that maybe there is some genetic mutation. Pancreatic cancer, they're in the same group. Colon cancer, yes, so there are a few cancers which could be related to some family history. If there is a problem in the family, then your question was, when do we start? Not too early, because we are going to scare that 20-year-old girl, and all life she will like, oh my God, I'll get cancer. Usually we start screening at the age of 35. It also depends how old was grandma when she was diagnosed. Because if grandma was 30 when she was diagnosed, then of course we should think she was 30, so there is a risk that someone in the family may be diagnosed with breast cancer around the same age. So we will lower that age. Yes? Usually, I believe from my experience that it's grandma in her 60s, 70s, so usually it doesn't mean that it's anything to run in the family.
I would advise that we do use the mic, because we are keeping this conversation between us all. You know, if I hear the answer when I don't know your question, I'm lost totally. I advise that we use the mics, please.
Hi, Dr. I have a question. In our hospital setups in Kenya, sometimes we misdiagnose between, they will differentiate between inflammation, breast cancer, and mastitis in perimenopausal ladies. How do you go about it?
Screening. Sorry, it's not screening anymore. Because once we have any symptom, it will be diagnostic mammogram and diagnostic imaging. Thank you, very important. And I did mention that inflammatory carcinoma. Inflammatory carcinoma looks like mastitis. Looks like mastitis at the age of 50. How many breastfeeding ladies do we have who are 50 years old? Few, okay? I'm not saying, even in Kenya it becomes more and more common, yes? When I moved to the UK, I'm Polish, so I moved from Poland to the UK, I was like, oh my God, this woman is 47 and she has her first child. Because of course in Poland, usually ladies are in their 30s when they have children. It's changing. It has changed in Poland. I left Poland many years ago. So probably now it's normal that a woman at the age of 50 has a first child. Yes? So it's rare, but not impossible. Now, thank you for that question, because unfortunately I have quite a few in my career here in Kenya. I have quite a few ladies with huge cancer, and the doctors treat it for mastitis, because first what they do, they check the tumor markers. You go to see a doctor very often and they say, let's do that cancer marker. Please don't do it. If they say, do the cancer marker, call me, ask me to come for coffee. It's cheaper. Coffee is, I don't know, a few hundred shillings. The tumor marker is usually 5,000 to 6,000 shillings, and it's useless. Yes? And then what happens, you have that woman, usually woman, the lab is saying, your tumor marker is normal, there is no cancer. So she believes in it, and then she keeps taking antibiotic for 2 years, 3 years, and cancer is growing, or maybe eating the breast away. Once a lady came, she was actually from Thika. A lady came and she said the doctor was very angry with her because the doctor recommended IV antibiotics and she wanted tablets. And the doctor said, look, your breast looks like this because you didn't want the IV antibiotic. The doctor is lucky he never met me. Yes, very lucky. Because he would have needed antibiotic for some other crushed nose or something. Yes, so mammogram. Mammogram, ultrasound scan, and a biopsy. Yes, just to finish that story. The tumor markers are useless. We use them for different reasons. The tumor markers we use when we know that there is a metastatic problem, we start the treatment, we know that the tumor markers is raised, and then with the treatment we are expecting the numbers to go down. It means that the treatment works, but it's not diagnostic. Yes? Any change in the breast, we talked about it, even if it looks like mastitis, even if it, let's say, mastitis usually should go away with antibiotics after week 2, let's say 4. But if it doesn't go away after 4 weeks of different antibiotics, we need to take a sample. Histopathology is the only answer. Yes? And it has to be ultrasound scan guided biopsy. Again, available in most of the hospitals in Kenya. I hope I answered your question.
My question is, madaktari wengine wanasema cancer iko na stages, stage 1, number 2, ama 3. Is that logic? Wanasema ikiwa stage 3 ama 4, mtu hawezi pona.
Thank you. There are two things which are a bit confusing about breast cancer. We have stage and we have grade. Grade, when we get the histopathology report, the histopathology is talking about grade 1, 2, or 3. And this is very confusing because we look at it and it says grade 2. Most of histopathology in Kenya, the biopsy will say grade 2 because it's a safe answer, because you can always change it to grade 1 or you can always change it to grade 3. I don't know if it's on purpose, but usually this is what I see. Sometimes it's difficult to assess. Yes, so grade is how abnormal the cells look under the microscope. So under the microscope, the histopathology team, they look, these cells, they look like breast, but they are too pink, or maybe too brown, or maybe they are too square. Yeah, so this is how they assess the grade. Stage, to do the staging, we need the CT scan or a PET scan, because stage means, is it in the breast only, and it's less than 2 centimeters, it's stage 1. Is it in the breast only, but it's more than 2 centimeters? It's stage 2. Is it in the breast and in the lymph nodes? It's stage 3. I'm making it very simple. It's a bit more. There is 1B, 1C, 1 whatever, so it's a bit more difficult in real life, but the easiest way to talk about it is it spread? So is it in the breast, in the lymph nodes, and in the bones? This is stage 4. Okay? I hope I answered the question. Now, it is much easier to treat the stage 1 and stage 2, of course. That's why the screening, we are talking about it. But we can also treat that stage 4. Yes? So sometimes I have a crying patient coming, oh, I was diagnosed with breast cancer stage 4. When will I die? Nobody knows. We can cure it. Maybe not 100%, but we can cure it. If we cannot cure it, we can keep it under control. How many of you takes pills for high blood pressure? Many, more and more young people, they need to take pills for high blood pressure, because if they don't, the high blood pressure can kill them. Does it mean that it's cancer? No. It's the same with breast cancer now. We may need to continue with some medication forever, but it doesn't mean that it's 6 weeks or 6 months or whatever. Nobody is God. Nobody can tell. Every one of us will have to die one day, but there is no answer when. Can you give me a date so I can plan it properly? Nobody can do it. Yes? So even stage 4, that metastatic cancer, if the treatment is planned properly, within the team, remember I talked about that multidisciplinary team. If I discuss everything with my colleagues from the team, we can keep that cancer under control for years and years and years. And finally it will be a matatu killing that person. Or maybe bota bota.
My question is, I'm interested to know, after cancer diagnosis and management, what is a woman's expectation, especially in the childbearing age? Does it affect it?
Okay, thank you. That's a very important question, and very important question after we said that 25% of breast cancer patients, survivors in Kenya, are ladies younger than 40. So, we can preserve, in my experience, when I started, there was nothing like preservation of the fertility. Nothing. We used to give the chemotherapy, and we used to do the surgery and everything else, and we were waiting. Life and body is stronger than anything human can develop. So I have patients I treated 20 years ago when I started, when they were young girls, and now they have 2 or 3 children without any help. Okay, so it is possible. Sometimes it's difficult, yes, because chemotherapy may kill the eggs, and then it's difficult to become pregnant. Now, fortunately, we have ways of protecting the eggs. So the oncology team, the oncology colleagues, they know that there is a special medication which can give to freeze the eggs, to, let's say, to put the ovaries to sleep. Because of course, if something is sleeping, it's not growing, it's not changing, chemotherapy cannot see it. And on top of everything, now we have even more. We can harvest the eggs, we can freeze them, and we can use them 5 years later after the cancer treatment and everything else. Yes? So we have more and more options. Of course, very often the question is, okay, but how much is it? Yes, to preserve the eggs, to plant the in vitro, it is about 800, 700, 800,000 shillings. Yes? But if one is insured, then of course it's much easier because we can push that cost to insurance. But even without any of those egg preservations and everything else, the body very often is much stronger, and I see smiling faces of my patients. Look, this is my baby. And we didn't do anything, yes? And I always talk to them, look, it's a bit more difficult. It may be more difficult to have a baby. Yes? I hope I answered your question. What is very important also, you see, and when we talk about this, what is very important, the treatment, especially the tablets, the tamoxifen, they may cause problems like vaginal dryness. Yes, it's not only about bearing children. It's more about how can I be the wife still after treatment? Yes, because I'm on the tablets, hormonal tablets. I feel tired, I feel uncomfortable, my bones are aching, my vagina is very dry. How do I deal with this? And my husband wants to have sex. Yes, because otherwise he goes and he finds another wife, one of 4. Yes, so these are issues actually very important to discuss with everybody. Yes, because it's not only about sex. All the ladies may, I'm not saying they don't have sex, yes, but all the ladies may have problems with UTIs, yes, with any infection problems, yes, because of course, if it's very dry down there, it's much easier to catch an infection. Yes, everything, fortunately things are changing, and fortunately we have answers to most of those problems and questions.
You said we do a mammogram every 2 years from 40 to 55. So if the mammogram always shows dense breasts, so is it advisable to still go for the mammogram or go for an ultrasound?
Thank you. That's a very common question. Mammogram is the screening tool, not ultrasound scan. With dense breasts and with young ladies, breast tissue is built of breast lumps, breast lobules, the breast tissue, and fatty tissue. So breast is a mix of 2 different types of tissue. With age, the breast tissue, the lobules, become a bit more fatty. So then we talk about dense mammogram or less dense mammograms, and again, there are 4 stages or whatever, yes? Now, usually we cannot, because the question is, oh, they said they cannot see anything. Can I be a bit naughty and nasty and politically not correct? If you know what you're looking for, you can find it. Okay, so my answer is, no, mammogram is very important, and I'm a surgeon, but if I know what I'm looking for, I can find it. The problem which we have, especially here in Kenya, we are lacking those radiologists, the people who know what they are looking for. And the easiest is, I see nothing. Yes, it's not true. Yes, very often we do mammogram together with an ultrasound scan, yes, because what we are looking for on a mammogram, usually it's white spots. Can you remember that picture of mine with that comma, with that little... So, of course, this is an artificial, this is a marker, we call it mag seed, but there could be, in the breast, there could be little white spots. Only mammogram can see it. Even MRI, which is, I don't know, 5 times more expensive, will not see it. Ultrasound scan cannot see it. I know 2 radiologists in the world who can catch breast cancer, very small breast cancer, on an ultrasound scan. 2. They are amazing ladies. Unfortunately, none of them lives in Kenya. Okay, so now my answer to your question is it worth doing an ultrasound scan if you know that they will not find anything? But if we have a mammogram with ultrasound scan, then of course it increases the chances that we can catch something. So going back just to that answer is, it's not about just doing a random scan. The doctor told me to do a scan, so I'll go, there is a little garage there, they do scans, let me do the scan. No, it's a waste of money, time and everything else. Yes? There are 2 best places in Kenya to do a proper mammogram, proper scan. Unfortunately, both of them are in Nairobi. One of them is called Aga Khan University Hospital, and the other one is in Pisha. Yes? They have doctors who know what they are looking for. Yes? Jalaram is getting better and better. Yes? Jalaram has very good equipment, and Jalaram is catching up. Yes? Nobody pays me for any marketing, unfortunately. But you can talk to Aga Khan and tell them that I...
Dr. Marek, as a survivor, one of the biggest problems we have in the country is stigma. As a medic, what are you guys doing to help survivors? Because it's a huge, I can tell you, it is a really serious problem, whereby family, people are sidelined, work, you know, like everywhere. And you know, people look at you like, and how many years does she think, or that they think they'll live? This is a cancer patient who can drop anytime. And we have so many cancer survivors who are not talking about it because of the stigma. Because like me, the most disgusting or comment is, Nana, why are you talking about it? And we know cancer always comes back. It is so heartbreaking. How do we handle this? Thank you.
I think the easiest, or let's say one of the ways to deal with it, is exactly what we are doing today. Yes? Because we have to spread the awareness. I'm here to send the message that breast cancer is not a death sentence, and it answers one of your questions. It's not a death sentence anymore. Doesn't have to be. Is it in Kenya? Sometimes yes, because of all those stigmas, because of all those myths, because of all maybe expensive costs, maybe something else. But we are here to change it. Yes? I will have some homework for everybody. I will have some homework. Whatever we discussed here today, I would like you to go home and send your wives, mothers, aunties, sisters for screening, please. Yes, it's very important because we have to start somewhere, and we start with ourselves. Yes? We talk, and thank you so much for sharing your experience. Yes? You told people, look, I had it, I'm fine. Look, I look fine, I look sexy. Yes? I look normal, I feel a woman. Yes, depending on the type of surgery, yes, we can sometimes, what we could change, and what I'm trying to change is we have a problem with breast reconstruction. Very few insurance companies in Kenya want to pay for reconstruction. Very few. Yes. Well, I had the same problem when I started in 2009 in Poland. Polish equivalent of NHS or NHIF didn't want to pay. A few years later, we together, yes, the patients, the survivors, the doctors, whoever is involved, whoever has anybody there, it's about telling people, look, this patient was treated 10 years ago, she has no breast and she wants to be a normal woman. There is no cancer, but there is no breast. She cannot be normal. She doesn't feel normal, yes? And we did, we managed, and now it took a few years. But the NHIF, or let's say the NHS, our public health insurance, started paying for reconstruction. Otherwise, it was a very expensive toy for very rich people because it could have been done only privately and only cash, nothing else. Yeah, so again, these are little steps which we have to talk about, we have to push. Nobody wants to listen to it, but hopefully one day there will be a Minister of Health with the same problem, who was diagnosed or who was treated or whatever, and then she will understand what we are talking about. Yes? Breast cancer happens to 1 in 7 ladies in the world. 1 in 7. I don't want to count how many ladies there are, but potentially we have a few ladies who either had breast cancer or will have breast cancer. It's a problem, yes, but we have to face it. Yes, if we don't face it, if we are going to hide and sit, not talk about it, that's it. We'll continue in those dark ages of taboo, myths and everything else. So I think we started today. We started talking about it. We are open about it. You from a slightly different perspective. I'm from a slightly different perspective. But look how many support we have. Yes, and everybody who's here is for a reason of changing something. Yes? Maybe because of a mother, maybe because of a sister, maybe because of someone else, but we started, and we started here. It's very difficult to push anybody there in the ministry of whatever. Yes, or they don't care. They don't care. So we have to push from the bottom.
Maybe one more last question. Dr. Marek will be around for a little bit in case anybody wants to ask anything privately, but anybody else? Yeah?
Dr. Marek, thank you for the talk. I just wanted to check, you had asked that it's good to be on a plant-based diet with fruits and vegetables. Then what is the best way to get in protein? Because that would also be an issue. I also have another question where I know family members who have gone through cancer and they were very scared to go for a biopsy because they felt that the cancer would spread due to the biopsy.
Thank you. That's a very important problem which we face here. There is that myth, I'm talking about the biopsy first, there is that myth that if you touch it, it will spread immediately. It's not true. What happens, unfortunately, in Kenya very often, we go to see a surgeon, the surgeon says, lump, let's remove the lump. To remove the lump, my fee is 100,000 shillings. I don't even, okay, I'm pretending I'm the surgeon. I don't do it. It's illegal, let's say it's against any guidelines, even in Kenya, okay? But because I want the money, I just do it. Then 2 weeks later, the histopathology comes, says, cancer. Cancer. Now we have to remove the breast, 180,000 shillings. Okay, so I made already 300,000 shillings on one patient. It's against guidelines. And it's very easy to support that myth, you see, if I touch it, it may spread. 7 out of 10, 70 to 80% of patients with breast cancer in Kenya are metastatic on the day of diagnosis. It's not the biopsy which caused the spread, it's the time, the delay which caused the metastatic spread. Yes? So it's not true, please, it's not true. There are special biopsy guns. The biopsy guns does anybody have a pen? One of those pens which you can click and... So when you click the pen, whatever comes out and then goes in. So the tissue is inside the tube. Okay, in medicine, I cannot tell you that it definitely will never spread, because it all depends on the technique and on other things. There is a study in Holland, and they found that cancer may spread during that old-style biopsy, and there may be a spread in the skin, but it's not a spread anywhere else. Yeah? So there was a study, and they said, yes, after the biopsy, if the surgeon doesn't remove the biopsy track, there may be, rarely, but there may be, like a little cancer somewhere where the biopsy was done. But it doesn't mean that the cancer will suddenly spread everywhere else. Not at all. Now, you see, the problem is, I'm Polish. I eat everything. But I'm married to a Gujarati girl. So I'm not, okay, it's not that I'm not allowed, but we agreed that at home we don't eat meat. Okay? She's very good. It's not like she told me whatever. Yes, but at home we don't eat meat, and I'm not missing it. It's not like I need to have that meat because I was born Polish and my grandparents used to chase deer in the forest. Yes? So fortunately, you see, places like Poland, it's very difficult used to be very difficult for my wife because we lived in Poland. We had cabbage, carrots, and beans from time to time. So how can you survive being a vegetarian? Yes, very difficult. Luckily in Kenya we have so many different options. Yes, we have vegetarian beans, vegetarian whatever, vegan. It's getting much, much better. Of course, so you see, for some people being vegetarian, they just do it because of their religion, because of the beliefs, because of whatever. We know now, theoretically, that the vegetarian diet is better than the meat diet for many different cancers. But at the same time, the vegetarian diet, especially the Gujaratis, all those odwas, dokras, whatever, causes lots of heart problems. The Gujus are worse than the Scottish. And Scottish drink a lot and they eat fat and nothing else. And Kujus, they are vegetarians, but Scottish and Kujus are at the top of heart problems. So unfortunately, whatever we do, there is always something, the dark side of the moon. You could be vegan and then it looks like it's not healthy.
Okay, Dr. Marek. There's been a lot of, I'd say...
Where are you?
I'm here. There's a lot of, on social media, people talking about the link between the bras that we wear and breast cancer. Another thing is also the size of the breast, that ladies that are blessed more with bigger breasts are at a higher risk. Are these myths or facts?
Thank you. Very good question, and it's true. Very often people blame the bras. It's not true. Yes, the bra doesn't cause anything apart from possibly breast pain. If there is an ill-fitted bra, and especially those underwired bras, the wire can be digging, causing pain. Yes, so pain, yes, but not cancer. Now, it's not about the size of the breast, it's more about the density of the breast. Yes? So the easiest way is to imagine, I don't know, we have a pot with seeds. And then we have 100 seeds in a pot, but we add some, I don't know, we are bakery, so we add a bit of this, we add a bit of that, and that 100 seeds, we have a tissue of, I don't know, 1 kilogram of bread. Now, the 100 seeds is the breast tissue. The same 100 seeds could be in a tiny little breast, but very dense, very close to each other. So we have a little bun. Yes? Is it okay? Can I do it? Yes. We have a little bun with or even a pie cake with 100 seeds. Still, it's the seeds which is the breast tissue. Yes? It doesn't mean that bigger breasts are at higher risk of developing breast cancer. It's those breasts with more seeds, more breast tissue, more breast cells. Very often in the clinic I see little ladies with tiny breasts, just 2 little pancakes, not even pancakes, and there is breast cancer. Chapati, tiny little. So it's not about size, it's about the density. And no bra they don't call the bras, they don't call breast cancer.
Should we finish? Yeah, ladies and gentlemen, I think if you will please give Dr. Marek a big, big round of applause.
Too early. Thank you so much, but it's too early. This is the time for homework. Yes? Remember, I did ask you, you need to take some homework. You need to do some homework, and number one is, ladies and gentlemen, you need to be aware of your breasts, please. Yes? So number one, I would like you, when you get home, I would like you to make sure that you touch it, check it. Number two, I would like you to use the opportunity of October Breast Cancer Awareness Month and have your screening mammogram. If you are 20-some, nobody will do a mammogram, you are too young, an ultrasound scan. There is always a reason to have it tested. We talked about the different changes in the skin, different changes in the nipple, lumps and bumps. It's always good to have that reference point. When you go to see a doctor with a problem, the doctor will say, have you ever had any scan? Usually the answer is no. Yes, so but if you have that reference point, which you can do tomorrow or next week or during October time, if you ever meet a doctor with any other problem, the doctor says, did you have any scans? Yes, I do. Keep the images, please. A good doctor will want to see the images. Paper, the report, they can write whatever they want to. You know, moon is pink, or I don't know, I love Kate. But the images talk more than many, many words. Yes, keep the images safe so we can always compare it. This is homework number 1.
And on that point, we have a mammogram at level 5. So Thika has a level 5 mammogram at level 5.
Please, let's start using it, because once we start using it, at least the hospital will be able to say, we have so many patients, clients doing mammograms, we need a radiologist. We need the technician to do the mammograms, because otherwise, how do they prove that they need anybody if it's not used? Yes? So this is homework number 1. Homework number 2, please talk to your friends, to your family, send someone, not only yourself, but send someone for a screening mammogram, please. Thank you very much. I'm sorry for talking too much. I hope it wasn't too boring, because once you put your phones down, I didn't see anybody playing with phone again. And remember about the Know Your Lemons. It's very useful. Thank you very, very much indeed.
Finish, I mean, Broadway is known for awareness in diabetes and sugar, but we've also joined this breast cancer campaign, and not just breast cancer, I think all cancers. That's why we're here. We're doing a whole month campaign on breast cancer and awareness, and with the help of Daktari. Next month is also, of course, diabetes month as well, so we'll be continuing that. But thank you very much. Thank you for your patience. Thank you for coming and listening. And yeah, as Doctor said, please do your homework. Thank you.